So like she said, I'm Bree Supa. I'm actually a physician assistant. I have the majority of my background has been in emergency medicine. And I have now been trained and certified by the American Board of Anti-Aging Medicine in functional medicine. And it has been a really fun journey for me. So that is a world we are in right now, is functional medicine. I am the head of the wellness department, and we focus on overall wellness. So if we're looking at we're looking at a person as a whole, rather than treating body systems. We're trying to approach health as a whole body system working together. And we have an approach that is lifestyle medicine or food-based medicine. So we have a really great team. I have Anne-Marie. She is our registered dietitian. Will you wave, Anne-Marie? All right, so she is just incredible, absolutely brilliant. She has the big role of setting up nutrition plans for our patients. So when we decide what a patient needs, where they're at, she personalizes a program nutrition-wise for them. So that is her role. And we have our sunshiny, wonderful Paige. She is our health coach. She's a certified health coach. And she is really has a great role of serving you and patients as helping with accountability, teaching patients to look inside themselves to find out ways to, keep themselves accountable, and trying to get ways for patients to maintain a lifestyle of change and health. So that is our team. We have some diversity in where we are hormonally, health-wise, experience-wise. So Anne-Marie, she is actually a mom of 4 kids who are high school age through college age. I have 2 young girls, and I have a 3rd on the way. So if I'm out of breath, it's because I have a baby pushing on my diaphragm and because I'm a little long-winded. And then we have Paige. She is a newlywed, and she's a dog mom. She's got 2 dogs at home. So a lot of diversity in our group here. And I wanted to introduce what we do, because sometimes it doesn't make sense of, hey, you guys are a nutrition plan, you do this, but wellness is, sometimes people look at it as a wheel, like a wellness wheel has several spokes, and you don't want one side of the spoke to be short or longer than other sides, or it doesn't roll well. So when we think of a wellness wheel, we think of, health, which would be nutrition, fitness. We think about emotional health, relational health. We think about financial health and sexual health. That is a big part of overall health and wellness. And sexual health plays into relational, emotional, physical health as well. So it is a very important topic. It's important to our group here. And the majority of who we treat are women. We are women. Our team are made of women. So we want this to be an intimate talk. We want to be able to be frank and talk about things like pleasure and orgasms, which is oftentimes faux pas. We always expect that from a man, right? Men, when they have intercourse, they're expected to orgasm, but women, it's a little bit faux pas, and I want us to be able to talk about that here and be comfortable in this atmosphere. So if you do have questions, please go ahead, type those in the chat section. You could chat it to the whole group, or you could send it just to Anna McCoy, who introduced, if you want to keep it private. And we can answer those questions, okay? Let me see. Is it gonna go? Yes. All right. So our agenda here is, this is kind of tricky because I cannot see the whole screen. I can see enough of it. My camera was on the side here. All right, so our agenda today, we are going really to be talking about changes in our sexual health that happen through life. So we're speaking specifically as we age today, and how that affects sexual function. And not only are we hoping to recognize what those changes are, I'm hoping that you can have a better understanding of what causes those changes. I always think that the more you know about what's going on with your body, the better you can help it. So I hope that we can educate you in those ways. We're going to develop some solutions to help combat negative changes you may have. Acknowledge your ability to be your best self. So just because you are at point C doesn't mean you can get to point A. You can't. We can get there. There are ways. We just have to acknowledge and accept that some things have to be done at a certain point. So I want you to know that we can get to a point where we can be our best self, even if it's a lot of work. And I want you to know your resources, know who's here for you. Belcara, we have a lot of good resources within our own group, and we have some good resources outside of our group as well. And just to speak on ability to be your best self, I wanted to just kind of open up to make this a more personal, relaxed, intimate area. I personally was someone who has learned a lot through working at Belcara and using some of our tools. There are different ways that women can orgasm. We can learn how, and this is not something that you always learn right in school. There are external and internal orgasms. And, external would be like a clitoral orgasm, which I think many women know about. But I think that many people don't know about internal orgasms. And I would say I didn't know that was a possibility until I was in PA school and was learning more about anatomy. And it is not something that many women experience. So just because it's common for people to have symptoms of decrease in pleasure or not experiencing certain types of pleasure doesn't mean it's normal. It doesn't mean that you should be there. There can always be ways of being better if there is that way in your anatomy. So utilizing some of the tools we had here, we'll talk about later. I now understand how that works, and I am able to be a person experiencing all those types of things. So I just want you guys to know that this is something that is potential for you. And I think that oftentimes we are told, well, that's normal, you're aging, or that's normal. A lot of people don't experience that. Just because it's common doesn't mean it's normal. So hopefully this provides you a lot of good information and tools. Let me see. There we go. So like I said, we're talking about changes with age. One of the important things to talk about is our hormonal change. We have a webinar coming up soon that is going to be specifically speaking to hormones, which is going to be absolutely necessary. As you will see, we are not going to get through all types of hormones, all types of changes we'll have, but I just want to have a generalized conversation about hormones that affect your sex life through aging. So first, just a picture. This is not the most scientifically specific. We don't have values on here, but it is actually a very accurate generalized picture of what happens to your estrogen as you age. So as we know, when we're premenopausal, before menopause, in a reproductive stage, we go through cycles, period cycles, and we have fluctuations in our progesterone, we have fluctuations in our estrogen and testosterone levels, and several other hormones as well. But it stays pretty high up in this area we're looking at here. And so this is estrogen we're looking at specifically. And then once you hit what we call perimenopause, which can happen early as 35 or even earlier, And unfortunately, can last up to 10 years. During that period of time is when people start experiencing some irregularities in their periods, so not as regular periods, or they're beginning signs of hormonal changes. So there are many whole body symptoms that you can experience during this phase. Again, we'll go into a lot of detail about that, but that is when people really start noticing some changes with their body. During this, people are still getting their periods because you see there's peaks and valleys. In general, it's moving in the downward trajectory, but we do have these peaks, and that's why women are still getting their period during that time. When you finally end your period, that's when it's called menopause. Once it lasts a full year of no period, then you enter into postmenopause. But menopause, you're not getting a period because your estrogen is low at this point. So when this happens, when this occurs, when you have this decrease in your estrogen, also in your progesterone, which is a little bit more dramatic, that starts high and kind of just sinks down. This is when we start experiencing sexual changes as well. A major change is a decrease in libido. So decrease in sex drive, decrease even also that would be, and even if you're able to have a start of a libido, unable to orgasm, decrease in lubrication, and vaginal wall atrophy. Now, this is a big one. I have a slide next. It's going to be a picture. I'm going to try to orient you to what we're looking at first. But this is a picture of what vaginal atrophy means. So I will describe that here. So what we're looking at is a picture of, this is the start of the uterus. This is your cervix. This is the vaginal canal. And this is a picture of the entrance to the vagina. So we're looking as if we're looking straight onto a person and they're cut in half. However, it's split. Only half of it is a healthy vagina. And this half is showing a picture of what vaginal atrophy looks like. So when we have a decrease in estrogen, it causes us a decrease in lubrication, a decrease in blood flow to the vaginal tissues, which in turn causes us to decrease in, it can cause shortening of the length. So see how, you can see how it looks longer here. So shortening the length of your vagina, it can narrow the wall of your vagina, so it feels like tight, but almost too tight because it also is decreasing elasticity. So almost like if you've ever seen someone who has circulation problems with their legs, their skin is easy to kind of peel and tear, like thinner skin. Same thing happens with the vaginal wall. We call that friable. Vaginal wall will become friable, and you can have bleeding with intercourse or just irritation. It bleeds easy. And this makes sex painful. You know, we've had multiple patients come in who are usually at this point in their postmenopausal range, and they feel like, I can't have intercourse anymore. It was painful for a long time, but now it's too small. It won't relax. I can't. And that's what's happened here. It's vaginal wall atrophy. Some other things that will contribute besides just hormonal changes is we decrease the ability to produce collagen as we age. So as we're younger, when we intake vitamin C, our body can turn that into collagen. We're producing collagen. Same thing happens with our skin elsewhere. That's why, you know, as we age, we start worrying about wrinkles. Like, why is this happening all of a sudden? I'm sagging a little bit here. My skin's not as tight. Same thing happens with your vagina. We can experience laxity. So where we just talked about with atrophy, you kind of feel this thinning, the stiffness. Laxity is another common issue. So it kind of sounds opposite, but you know, you lose sensation because you're so relaxed. You have change in your external appearance of the vagina. So you can have hyperpigmentation, so discoloration, wrinkling in the external vagina, so in your labia, And that can also be a problem in itself. If you have extreme laxity in your labias, that can cause friction. If you're having intercourse, the labia can get in the way, and that can also contribute to pain. Laxity can also, of course, happen after childbearing or significant weight gain and loss, or having any sort of prolapse of organs where whether your bladder or your rectum starts kind of falling into the space of the vagina. Urinary and bowel incontinence, also things that are more and more common with age, more common after childbirth. And that, of course, is going to affect your sex life because, one, it could be embarrassing, it could be uncomfortable. So another symptom that can contribute to interference with a positive sex life. We also can experience psychological changes as we age, or even young, of course, but as we age, it's more and more likely. It's more likely for a woman over 45 to be on medication for anxiety or depression. And that, of course, is going to contribute to your mindset around sex, to your libido, and medications also contribute to libido and how you feel around sex. So definitely a psychological aspect to sex. Changes in your aging body can also make an impact on how you feel. If you feel bad about yourself, that can cause you to have a decrease in libido. We have actually, speaking on this, we have an article, I think it's going to be coming out as a blog coming up, from one of our friends at LifeSpring Counseling Centers. And they're one of our resources. We'll have them listed at the end for you. But she is a counselor who specializes in sexual health. Really a good resource for you guys if you any interest in that. And chronic disease states also going to contribute. So when we have, as we age, we have more and more impact on our life. We've lived more life. We've had more toxic burden, and there is an increase in chronic disease states that comes along with age. And really important we combat this because, like we talked about, blood flow is really important for your vaginal health. When you have any sort of cardiovascular disease, even if it's just hypertension or just high cholesterol, your body is made for survival. Your body is going to want to send the blood it has to your vital organs. So not always being directed to your vagina, to your sex organs. So chronic disease states, especially with blood flow, that's a major impact. Things like diabetes can cause neuropathy, problems with sensation, which is going to also affect your sex life. And even GI issues. That's a very common one we see is people come in with GI issues, and that is absolutely going to affect your sex life because you just don't feel good. And also bowel incontinence. So let's get into what we all are here for, is hearing about some solutions, what we can do about this. So first off, I just wanted to start kind of moving backwards to forward. So starting with those chronic disease states, of course, it's important to be seeing your primary care and taking whatever medications are recommended. I also do recommend our BH wellness program. So looking at the full body, looking at the full picture, us, working on lifestyle to make changes, because there are significant things that can be done about your overall health. You can stop many medications just based off of changes in lifestyle, as long as they are something sustained and you have the right direction or right path. So our BH wellness programs are a great way to go about that. If you have interest, have some chronic disease states, please feel free to reach out to Paige. She can help direct you to what she thinks would be best for you. But getting that under control is going to be important. Changes to the aging body we talked about, that can be self-esteem, lowering, or things even like I talked about, labias being interfering, causing more friction and pain. Definitely can be reaching out to our plastic surgery team about labias, the shape of it, and also for aesthetics, things to help with how we feel about the way we look. And then mental health. And I talked to you guys about our team that we use over at LifeSpring as being a good resource for us. And then next, this is the fun stuff. This is hormones. So how do we fix what's going on with your body hormonally? If your body stops producing hormones, what are we going to do with that? So I will say what our team's approach to this, it might be different than some of those other teams that give hormones, because I always like to start with lifestyle. So treating hormones using these wellness programs I spoke about. So I want to first always look at what you're doing with your overall health. I always want to look into labs and make sure what's actually happening is not an incorrect pathway. So sometimes people actually do have enough estrogen. It's just turning into the wrong type of estrogen. We have 3 different types of estrogens. I'm trying not to get too into that at this visit, but we do need to make sure our hormones are on the right pathway. So we do some in-depth testing. I like to correct nutrition. I like to work on really focusing the patient's lifestyle to get our bodies to optimize, do the best of what we can do before putting people on something like I don't know how to get that out of here. Before I put somebody on something like a BHRT or any sort of medication that could be long-term. BHRT, after we work through lifestyle, making sure we're on the right path, BHRT or bioidentical hormone replacement therapy is an amazing option. I think it is a wonderful choice for a treatment for many, many patients. I think it's best to start if you are in that perimenopausal phase, just starting with this and then moving forward. I think the earlier you start, the better. However, it is something that usually, if you want to continue feeling well long-term, you probably are going to be on it, possibly forever. I will say some people, once they get to that postmenopausal after a year, can stop it without having symptoms return, which is amazing, especially if they're working on their lifestyle. However, there are a few things I want to note about bioidentical hormone replacement therapy. Some people talk about HRT or hormonal replacement therapy. So there are different ways that you can receive hormones. So even birth control is hormonal replacement therapy. We use bioidentical hormone replacement therapy here. Some people say it's natural, or the other type of hormonal replacement therapy is synthetic. I will say, just to be clear about what it is synthetic. It's made in a lab. However, it's important that when you get hormone replacement therapy, for it always to be bioidentical. Bioidentical means it is it's matched up exactly the same chemical format as what we make inside our bodies. This is really important for your body safety. So this honestly has much less potential of causing hormonal type cancers, which is something we always worry about with hormone replacement therapy, but bioidentical is always the way to go to help prevent that. Another reason we do so much testing on patients and really like to keep track of what's going on with patients is because we don't want any negative side effects. So we would be making and should be making. There are a couple different ways that we can give this. I will say another thing that's dangerous and you want to watch out for is if you ever go to a clinic and they offer you a pellet right off the bat. Pellets are a great tool, but pellets are inserted. They're inserted into your tissue, and in your hiney, we use pellets for long-term treatment. So once they're in you, they're in your subcutaneous tissue, which is your fatty tissue. They stay in there forever. Can't take them out. So I don't like to start people on that. I would start people on something and make sure we have their dose regulated for at least 6 months before trying pellets. Pellets are great though, because they're super convenient. So patients who've been on hormone replacement therapy for a while, they get tired of either putting cream on themselves or taking pills or giving themselves injections. So that's when pellets are a good option. But I never like to jump into that. That's at least 6 months down the road after treating with hormone replacement therapy. And I think we'll probably go into more detail about how to choose which one at our next webinar series, so I don't go too long here. And then this is the fun stuff. This is a little bit easier for patients because, it doesn't take as much of a time commitment from you, lifestyle commitment. I still I'm going to push that lifestyle change on people because that's what's really going to make the major difference. But if we're looking specifically at just rejuvenating the vagina itself, so this is not an impact on your hormones, your sex drive necessarily, but doing an impact on improving the health of the organ itself. So what we're looking at first here, I have core intima. I think core intima is absolutely amazing. It is a laser treatment. And what it does is it helps restore collagen and blood flow. The way it works is just like any other laser. It's causing micro trauma. So causing micro trauma to the tissue of your vagina is going to call all helpers to come back. So it's going to call fluid and blood flow and collagen to come restore in that area. I recommend this for especially my patients with vaginal atrophy, with especially the narrowing, thinning of the vaginal wall, pain with intercourse. This is my go-to. It also is really, really beneficial for patients who have any urinary incontinence, especially post-giving birth. So core intima is a really good option. Essentially what it is, it's like a tube at the end of the laser that gets inserted into your vagina, and it's rotated inside your vagina as laser goes on, and she pulls it out a little bit, rotates it again, and each level so that the entire vagina is treated within the vaginal wall. We also can use it on your external labia if there is laxity of the tissue. It is not like a labiaplasty where you can cut off the tissue. It's not going to change the shape of the tissue, but it can change the texture, so kind of smooth it out. And it can also help with any discoloration. So hyperpigmentation can help lighten that color. So this is a really good option. I cannot wait till after I have this baby. I'm definitely going to have this done to me. And O-shots I've used for myself before. Absolutely believe in them. I think they work really well. So what they are is platelet-rich plasma vaginal injection. So what that is and why I think it's so awesome is it's because you're using your own body to heal itself. So what we do is we take blood from your arm. I would spin it down in a centrifuge, and I would take from that blood part of the plasma that is rich in platelets. And platelets are going to have growth factor, activating factors that also do the same job of drawing in blood flow. And so this is something I think is really good in conjunction with core intima for patients who have vaginal atrophy, have a decrease in lubrication. Those symptoms, I think that they go really well hand in hand. I think O-shot also is really good for patients who are just looking for an increase in pleasure, want to experience more intense orgasms, or just want to improve their sensation. I think this would be my first recommendation for that. But if there's any sign of atrophy, I also like core intima or core intima alone. And then lastly, physical therapy and exercise. So unfortunately, we were going to have Dr. Noble here. She was unable to attend tonight. I think she is going to try to jump on at the end of our future webinars to answer a few questions for you guys. But physical therapy, exercise for your vagina is very important, because having strong musculature around your vagina, your pelvic floor is what we call it, is really important. And there's different tools. So like I said, there's different problems. So if we're having laxity, you want to do exercises of squeezing. So that's called Kegel exercises. And I really hope that she's able to jump on and share some of that information with you guys. Whereas vaginal atrophy, when we're having narrowing or a lack of flexibility, she can teach you about ways to improve that flexibility. Okay. So in conclusion here, guys, I'm on my home stretch. Thank you for bearing with me if you're still here. But the point of all of this is for us to know there are many aspects that contribute to our sexual wellness. It's multifaceted, but thankfully, there's also many ways that we can address it, many ways that we can approach it and improve your ability, your pleasure. And so you do have resources. I want you to know what they are. BH Wellness Team, that's who we introduced before, including myself. We have our aesthetic team. We have our plastic surgery team as well. Pelvic Pride Physical Therapy, I had spoke to you about. That's with Dr. Noble. And LifeSpring Counseling Services is a really good resource for you guys. And we actually have articles from both of these groups in our blog. So keep your eye out, really good information about sexual health. All right. I also just want to point out, if you want to reach out to us, I have pages, information down here, our phone number at the bottom. So please feel free to give us a call. If you are interested in a consult, which I believe we are offering free consults to patients who are here at this webinar. So that can be up to a $240 value. So that would be cool to meet you, see you in person. But yeah, if you guys have any questions, we can go ahead and shoot.
Sorry about that. Okay. Can you hear me?
Do you know the host?
Can everyone hear me?
Yes.
Perfect. All right. So thank you, Bree. Thanks again to all of you for tuning in tonight. I hope you all enjoyed the presentation portion of tonight's event. And right now we're going to roll right into the Q&A portion. I did pull a few questions. Let's just ask this first one here. Does core intima hurt? How about the O shot?
That is actually a great question. So core intima, I will say it depends on the patient. So I have had many patients come in for core intima, and they usually have no pain with the internal portion of the core intima, doing the vaginal treatment, which is really what the treatment is specifically for. And as some patients also like their external vagina treated, and I will say that is a pinching sensation is how most patients describe it. It usually, I would say most people are surprised when they first feel it, because we'll do the internal first and they're like, I feel totally fine. And then once they do the external, they're like, oh, I felt that. But then they're like, okay, it's okay, I can handle it. But the external, I think, is more of a pinching sensation. Internal patients handle really fine. If you have severe vaginal atrophy, it can be uncomfortable. If it's uncomfortable to have a pelvic exam or have a speculum inserted, then likely it will be also uncomfortable to have this device inserted. It's smaller than a speculum. However, it just depends on your level of vaginal atrophy. And then as far as an O shot, I think that also is pretty patient dependent. You know, I personally don't think getting blood draws hurt at all. The internal, there's 2 injections for the O shot. There is an internal, so it goes into your anterior vaginal wall, near where your G spot is, where we would want you to be able to experience orgasms. That injection does not hurt at all. You barely feel it. The clitoral injection, again, some people say a pinching sensation, but we usually do use numbing cream, so I don't think many people experience that type of pain. However, some people do feel fullness of having fluid going into a small space, but people tolerate it very, very well.
Perfect. Awesome. Thank you for that. Let's see. We have another question. How many sessions of the core intima laser are usually done?
Okay, so core intima, I will say we do 3 sessions usually initially. So about a month apart, so 4 weeks apart. I don't like you to schedule it on your period. Both procedures are safe procedures. However, if you're on your period, periods are fluid and fluid reflect light. So that does increase risk for burn. So I don't have people come in if they're on their period, but 3 sessions about a month apart is how we do it. Occasionally women, especially if they are in that perimenopausal area where we're having fluctuations in what our estrogen's doing, they have some progression of atrophy where it can be done again, like a touch-up is what I call it, within the next year. And I usually just do 1 session then if a patient needs that. We don't do the whole 3 sessions again.
Next question. Do all women in perimenopause or menopause or postmenopause experience sexual changes? If not, what percentage do not experience any changes in their sexual function or pleasure?
So I could not speak to percentages, but I will say that the majority of women will experience symptoms. Menopause, by definition, is having your estrogen, you're stopping estrogen. So there are many symptoms of estrogen, and not every woman presents the same. Commonly, sexual symptoms are present. And we'll talk a lot more about other symptoms because menopause does affect the whole body. However, I think that many women do experience sexual changes. Because, people think of estrogen, testosterone, progesterone as sex hormones. That's not necessarily what they are, but that's one of the major impacts they have.
Awesome. Next question. Are there any foods that can help with benefiting sexual wellness or overall?
Yes, that's an awesome question. Anne-Marie, well, let's get our registered dietitian on here.
Hey, everybody. Can you hear me?
Yes.
Okay, perfect. So there are several nutrients that really are focused on improving your blood flow and helping to improve hormone regulation. So when we think about what we're eating, you really want to think about minimizing any of your processed foods that are really ultra processed foods. Those foods are going to be really high in sugar, high in fat, and they're going to be low in nutrients. You really want to concentrate on a lot of foods that are just more nutrient dense. So specifically, like omega-3 fatty acids are great for decreasing inflammation in your body. And you can find, of course, omega-3 fatty acids are really good for vascular cardio disease and things like that. So we know that, but they're also good for your hormones and regulation of your hormones. So thinking about, walnuts and salmon and tuna, things like that. Some other vitamins that you want to think about are your B1 vitamins. They help with, which is thiamine, which helps with your nerve function and your signaling between your brain and your sexual function organs. And then also zinc too does a lot of that. So you want to think about nutrient-rich foods with the zinc would be like oysters, beef, lamb, some of your meats, of course. And then your nuts and seeds are really high in thiamine as well. So it's another reason to kind of focus on good, healthy meats as well as nuts and seeds. And then lastly, nitrate foods that are nitrate rich. So this is something that you can hear often. Beet juice is, for example, is high in nitrate, and nitrate will change to nitric oxide in your mouth and in your stomach. And it's that compound in your body that will increase your vascular changes will cause changes in your vascular system, and actually can help to change your blood pressure if you have high blood pressure. And so foods that are high in nitrate is going to be your dark chocolate, but also beets and bok choy and Swiss chard. So a lot of vegetables are going to be high in nitrates naturally. So really thinking whole foods as much as possible and nutrient dense. When you think about this too, you want to think of every meal eating kind of whole foods and being balanced.
Awesome. Thank you, Anne-Marie. Next question is kind of rolls off of what you were just talking about. Is it possible for dietary and lifestyle improvements to completely reverse sexual function and pleasure, or are treatments like Core2, Intima, and P-Shot often required for optimal results?
That's a good question. So I would say that's person dependent, and that depends on the level of disease state a person may have. I think that also depends on where we're at in our hormone function. So yes, I do believe that dietary and lifestyle changes can make it so that you are going through menopause essentially symptom free, very mild symptoms, not for everybody. Some people do need assistance in other ways to be at their top of their game sexually, so to speak. But yes, I do think it's possible for lifestyle changes to change your sexual function. Lifestyle has a huge impact on your hormones, really more major than you could ever imagine. So yes, it is possible. I think, if we are already at a point of vaginal atrophy, usually something will have to be done about it. But I will say, for example, I've had a patient who for years and years and years has been on pellets, so hormone replacement therapy. And they finally decided to come in with us, do some major lifestyle changes, had a great effect on her overall health. And then I'm noticing, hey, you haven't come in for that pellet. You used to come in every 6 months. It's been a year now. I don't need it anymore. I don't need it as often. So you can make major changes with lifestyle on your hormones. As far as what your actual anatomy looks like once the changes are already made. Sometimes we do need the extra assistance to increase that blood flow again, but I think that, it is possible.
Great. Next question. How can stress affect my sex life?
So stress actually is something we perceive in our brain, and it has a hormonal response. So different hormone than our sex hormones. Specifically, you think of our hormone cortisol as our stress hormone. But hormones, what they are, they're communicators. So they're just talking to each other, telling our body what to do. Hormones are the messengers to our body systems, tell our body what to do. So stress is going to send a hormone. It also is just like how we're saying, the psychological aspect. If you're anxious, if you're feeling depressed, if your mind is on something else, it can be distracting from your sex drive. And that's also something really interesting, that article that's coming out. I would recommend you read it. But there are a lot of things that can be done also about stress. Honestly, we probably need our own little education. We have a class that we do on stress and sleep that we would love to have patients and anybody attend at some point, but definitely can have a negative impact on your sex life and even function, depending on if your stress is so significant or prolonged that it's actually affecting your hormones. Did that answer it?
Yeah, perfect.
Okay.
So let's see. This is kind of a broad question, but someone asked, how can I boost my libido?
So that is a lot about what we talked about with, it depends on what is the cause for the decrease in libido. So if you're hoping to have an increase in your orgasm, blood flow. That's a big part of it. So I would say doing something like an O shot is a good option. But in general, I think what Anne-Marie talked about as far as foods that improve blood flow, that's a very important way. And also hormones. Like I said, first thing I said about hormones, when we have that major decrease in our estrogen, also our progesterone, testosterone, that's going to affect our libido. So making sure your hormones are in check, doing some digging, find out what the cause is for that specific person.
All right, well, that's about all I have for the Q&A for now. So unless anyone has any more questions they want to shoot through, I think we're in a good spot to move on to the, the giveaway for our women's wellness package. So our winner is going to be Allison. Congratulations to Allison. And Allison, if you could just, round of applause for Allison. If you could just shoot me an email to that events at Belcara Health that sent you the event link, or write us on Instagram. However, give us a call and just say, I'm the winner. They'll put you in touch with me and I will walk you through how to obtain your prize. So congratulations. So as a reminder for anyone who's interested in taking advantage of their complimentary consultation, I'll be sending out a follow-up email to everyone tomorrow with instructions on how to schedule that. If for whatever reason you don't receive that email, just give us a call and our team will take care of you. So yeah, thank you everyone for tuning in. As a reminder, our wellness team is currently accepting new patients. So if you're interested in learning more about our wellness treatments and programs, you can visit us at belcarahealth.com to learn more, or give us a call during office hours to speak to one of our patient coordinators, 410-296-0414. So yeah, this will conclude our webinar for this evening. Again, we appreciate you all for attending, and we hope that you guys learned a lot. And have a great evening. Did you want to say anything, Bree?
No, thanks for bearing with me. Have a great one.
Everyone have a good night.